Good evening all. Today our topic of discussion is the infections of the CNS. So it appears usually in the form of meningitis and encephalitis. First of all, meningitis. What do you mean by meningitis? So it is the inflammation of the meningeal layers of the brain and spinal cord, which means these are the protecting layers of the brain and spinal cord. So these are nothing but dura mater, arachnoid mater, and pia mater. So among these three, usually arachnoid mater and pia mater are affected easily. So along with the arachnoid mater and pia mater, so the CSF will also be affected by this any infectious agent. Next, so what is the classification? So it is classified into the bacterial meningitis, and tubercular meningitis, and viral meningitis. First of all, bacterial meningitis. And here the most important point is what are bacteria, but especially in the neonate. So it is the E. coli and the streptococci pneumonia. Next, in the infant, it is the hemolytic influenza. Next, in the early adult, it is the Neisseria meningitis. Plus, in the adult or old age, it is the streptococci pneumonia. So, in case of pregnant women or diabetic women or too old age or immunosuppressive state patient, it is the Listeria monocytogenes. Next, so in case of post-traumatic or post-surgery, so it is the Klebsiella and Pseudomonas will be responsible organisms for the bacterial meningitis. Next, so what are the symptoms? Usually we know the bacterial infection symptoms are like fever and headache and vomiting and nuchal rigidity, as well as Gerdnick sign and Brzezinski sign are the very important. And next, how this bacteria will enter? Simple. It may be the airborne, or it may be the waterborne, or it may be the nasopharyngeal route entry. Simple. Usually it was localized. It crosses the blood-brain barrier and disruption of blood-brain barrier and entry and take the entrance into the neural as well as glial cells, especially in the medulla system or ependymal cells. So it gets lodged. So depending upon the immunity level, so it may be activated. And next, so what is the commonest? What is the commonest cranial nerve? So sixth nerve palsy is the common cranial nerve presentation of the any bacterial meningitis. So, plus, bacterial meningitis usually affects the basal cysternus of the brain. So usually the convexities are spared. Yes, usually the basal cysternus will be affected by the bacterial meningitis, which means so the basal cysternus are filled with inflammatory exudate. So the surrounding tissue may get regenerative, which means inflammation, or sometimes so the surrounding arteries may develop vascularitis, and furtherly it may lead to the endoarterial proliferation, and sometimes it may lead to the vasculitis and followed by ischemia of that area particular symptom. So especially the basal cysternus, as well as the sixth nerve palsy will be seen. Along with sixth nerve palsy, seventh nerve and eighth nerve palsy will also be seen. Next, tubercular meningitis. Usually the tubercular meningitis is the commonest form of the CNS infections of the tuberculosis bacteria. And so meningitis is the commonest presentation of the Mycobacterium tuberculosis in the CNS. Next, so in this tubercular meningitis, both T cell mediated as well as the B cell mediated immunity as well comes to the action. Next, this is also inflammatory mechanism or inflammatory exudate as well. So this is also presenting on, or this is also accumulated on basal cysternus areas. Next, yes, what is the best diagnostic test? It is simple. It is in ADA level. Okay. adenosine deaminase activity levels as well as culture is the best diagnostic test for uh, tubercular meningitis. Next, so viral meningitis. What are the commonest? As one the what are the commonest viruses? So the commonest virus is what? So it is enterovirus. Enterovirus. Next, the commonest sporadic form of encephalitis. It is the sporadic. So sporadic form is the herpes simplex virus. So the commonest epidemic form of encephalitis is the epidemic form of arbovirus or Japanese encephalitis virus. So these three are the very important. So next, so what are features? What are features of viral encephalitis? So simple. So like all other inflammatory constitutive symptoms like fever, headache, vomiting, nausea, and dullness, drowsiness, as well as ultrasensoriums. Okay. So these are all commonly present. Next, what are complications? Yes, what are complications? Yes, what are complications of the what are complications of the meningitis as well as encephalitis is nothing but it is accumulation of exudate, so leading to fibrosis or leading to obliteration CSF flow, as well as sometimes the chronic inflammation of the internal ventricular system, which leads to the obstructive hydrocephalus, or sometimes so when the mass accumulation is more, or sometimes it may lead to the tentorial herniations. Okay, so these are the common presentation. Next, so the CSF examination is the very important for diagnosing the or for differentiating the different etiologies of the meningitis. First of all, the most important is bacterial meningitis. Now, in case of bacterial meningitis, polymorphonuclear cells are increased. So bacterial means acute. So that's why the neutrophils or the polymorphonuclear cells are increased. Second one, protein content is very high. And third one, as glucose is very decreased and the chlorides are very decreased. Plus, so the appearance of the CSF is the turbid in nature. Most important. Bacterial meningitis is examination of CSF for bacterial meningitis is the first one. It appearance is the turbid. Bacterial means turbid. Plus increase the cell count, especially the neutrophil count was increased because of acute bacterial infections. Plus increase the protein because of exudation. Plus the glucose content was decreased because of consumption by the bacteria. Next, and the chlorides are decreased. So this is the presentation of the bacterial meningitis. Next, tubercular meningitis. In case tubercular meningitis also, when it appears as a mild cloudy or cobweb formation will be seen because of the accumulation of fibrinogenic products, cobweb appearance. Next, pressure is slightly increased. Plus, so the cells are predominantly lymphocytosis or pleomorphism. So lymphocytes as well as monocytes will be appear, pleomorphism. Next, protein content is increased but not as bacteria, bacterial meningitis. Next, so protein. Next one, the glucose. As glucose content may be normal or slightly decreased. Next, chlorides are decreased. So the most important feature of the CSF feature of the tubercular meningitis is the cobweb formation, increased pressure, increase the lymphocyte counting, plus increase the protein content and decrease the bacteria, decrease the glucose and decrease the chloride content. Next one is the viral meningitis. In the viral meningitis, so the appearance is very clear. So the appearance of CSF is very clear. plus the pressure may be slightly high, or protein content may be normal, and glucose is normal, and chlorides will be normal or slightly decreased. And the most important thing is the lymphocytic dominance. So the cells are dominant. So the dominant cells in the CSF is the lymphocytes. So these are the features of the. So these are the three differentiating features of the bacterial meningitis, and tubercular meningitis, and viral meningitis. So these three are the very important features.